Back and neck pain, cause and cure. I'm Dr. Richard E. Bush III, and we're going to talk about the cause and cure of back and neck pain today. The first thing a lot of people want to talk about is pathology. We don't want to talk about that today, however, because in most cases, if you have a pathology, first of all, you're not going to have been in my office, and second of all, we would have moved you out and had you evaluated for other conditions at that point. However, if you have mechanical back or neck pain, that means that things aren't moving quite correctly. And that's something that I treat as a chiropractor, and many physical therapists and even massage therapists actually work with that as well. So that's kind of secondary to what we're talking about today. We're talking about the more important stuff. We're talking about herniated disc, degenerative disc, and even spinal stenosis. When we talk about a disc is a shock absorber in the spine, and the way that it's put together, the inner portion of the disc is a jello-y, watery type of a substance. It's called the nucleus pulposus. And the outer portion of that disc is actually called the annulus fibrosis. It's more of a cartilage type of a structure, and it works a lot like a water balloon. If we had one sitting on the edge of the table, you'd see the sides pushing out. We push down on the top, it expands out in all directions. When we let it go, it goes back to normal. When we talk about a herniated disc takes place when that jello-y substance on the inside of the disc is put under a great deal of pressure. The cartilage around it can't hold it back very well, and it just kind of tears. And that causes a little portion of that disc to bulge out. This wear and tear allows that disc, or the cartilage structure, to push against the nerve, which doesn't allow the proper information to get from the brain to the rest of the body. It was shown in a University of Colorado study back in the mid-90s that 10 millimeters of mercury pressure on a nerve, which is about the weight of a dime, will reduce the effective functionality of a nerve by about 60%. That's not very much pressure when we talk about it. A lot of the patients that we treat, and we're going to talk about a special type of a treatment here in just a second, it's called spinal decompression utilizing the DRS protocol. But the patients that we see in many cases have had steroids and other anti-inflammatory or addictive medications. They may have had some addictive narcotics or even antidepressants as far as treatment. They may have had physical therapy or epidural injections, even failed back surgery, 1, 2, 5, up to 10. They may have had a spinal cord stimulator or even a disc replacement surgery. Now, when we talk about the DRS protocol stands for decompression, reduction, and stabilization. And what we're doing here is we're pulling the disc level apart, which allows us to bring in oxygen, water, and nutrients back into the disc and allows the disc to heal really from the inside out. We have it before and after MRI here. This is before the treatment on the left, and you can see that little white area is the intervertebral canal where the spinal cord goes. And then on the after, you can see that there isn't that little part of the disc pushing out. It is circled on both of those, so you can see that a little bit better. If you're interested in this type of treatment and the type of things that we do with the DRS protocol and spinal decompression, please check out our book at either bushchiropractic.com or surgerynotIncluded.com. The book's called Surgery Not Included, Freedom from Chronic Neck and Back Pain. Again, Surgery Not Included, Freedom from Chronic Neck and Back Pain. Please check it out, and if you have any questions, we can